Good morning, ladies and gentlemen. We proudly welcome you to AMSA's special event, Organ for Health Campaign AMOH 2021, organized by AMSA UPM. My name is Arvin, and I'm a first year medical student from UPM, and I'll be the moderator for this session. Our first activity of the day, organ donation and transplantation talk session, will start soon. Here are a few announcements from us. First of all, QR code and Google Form link will be shown and pasted in YouTube comment section at the end of the talk. Please fill in the form within 3 minutes to record your attendance. Second, if you have any questions popping out during the talk, feel free to type it down at the YouTube live comment as our speaker will answer your question during the Q&A section. Third, please like and give us some reaction throughout the talk to show your support towards our speaker today. Do share our live stream with your family members and friends so that more people can gain benefits from our event. Your support throughout the event is greatly appreciated. Thank you. Before we start, let's watch a video from AMSA Malaysia.
Asian Medical Students Association Malaysia is the most far-reaching and the oldest Malaysian Medical Students Association established in 1983. AMSA Malaysia has no Asian Medical Students Association Malaysia is the most far-reaching and the oldest Malaysian Medical Students Association established in 1983. AMSA Malaysia has nurtured future doctors-to-be to disseminate knowledge, undertake creative vocations, conduct community services, and foster new friendships. Now, AMSA Malaysia has blossomed into a member-based, non-profitable, non-sectarian, and non-political organization. With friends and members present countrywide, AMSA Malaysia has new offshoots budding, which are public relations and alumni, academics and research, multimedia and publicity, public health, and the Asian Medical Students Exchange Program AMSEP. The fundamentals rooting AMSA Malaysia for its sustenance to this day are knowledge, action, and friendship. Follow us on our social media at Facebook and Instagram. Stay tuned to AMSA Malaysia. Viva AMSA, building bridges, sharing dreams.
Before we proceed further, let me introduce you to our campaign. Organ for Health Campaign AMOH 2021 is a campaign organized by Asian Medical Students Association, University Putra Malaysia, AMSA UPM. This campaign with a theme of a neglected demand in society, one act saves eight, aims to instill awareness among the public and students of Faculty of Medicine and Health Sciences towards the importance of organ donation and also transplantation. For today's event, we have planned a few activities which will be carried out, namely, first of all, organ donation and transplantations talk session with Dr. Melvin Edward, Head of Department for National Transplant Resource Center. Second, let's hear her story by Dr. Antonia. And third, quiz session regarding the truth or myth of organ donation. Please support and join us throughout the event. Now, we would like to present to you the multimedia show from AMSA's Tech Department regarding the life of organ donor and recipient. Hope you enjoy the video.
I'm meeting my donor family today. I received my heart on April 30th, 2017. I know his name is Rob, and he was 30 years old. And I would just like to hear about his life.
Just look at what we're doing today. I'm going to meet the recipient of my son's heart. He died on the job, and no one saw that coming.
He was just such a sweetheart, a real sweetheart. Very empathic, very kind, very loving.
I'm just very, very happy that I'm going to get to meet Elizabeth because in the end, I am sure if Rob was behind me, he'd tell me, go ahead and do this. Because that's the kind of guy he was.
I was just thinking about what I wanted to say to them, so how thankful I am that they chose to donate life. Hi.
Elizabeth.
Yes.
Hi, Bob.
Hi, Bob.
How are you?
So nice to meet you. I'm here because of your son.
So happy. So happy.
So happy to meet you.
It's my wife, Marla.
Hi, Marla.
I felt like I was going to lose it when I saw her, but it was very strange that when she walked in, I just felt a calm.
I want to thank you for the decision on that day. I wouldn't be here without
We're
Rob.
thrilled about it.
Absolutely. It's absolutely fantastic.
It's one of the greatest gifts I've ever received.
She's thanking me, and I feel like I should thank her.
For keeping Rob alive.
Yeah, for keeping Rob alive.
Do you want to listen to his heart beat? Yes.
Yes. There you go. There you go.
Yes. Yes.
I'm glad I didn't break up too much, but it was exactly like holding him. It was. That's how it was. I miss it dearly.
I've been praying for you, for him. I've been able to live a full life. I've been able to live a life I couldn't have lived without it.
That's just a beautiful thing.
It is. It's tremendous.
Without the organ donor, there's no story, no hope, no transplant. But when there's an organ donor, life springs from the dead, sorrow turns to hope, and a terrible loss becomes a gift. This sentence has brought a lot of meaning and is an actual eye-opener for everyone here today. After watching this video, I would like you to answer two questions. Please go to Menti website and enter the code 27278399. So the question is, would you like to be an organ donor? Please vote for your choice. You're given 3 minutes. All right, so most of you have voted for yes. So now I would like to hear your reason for your choice. In the previous question, you are also encouraged to share your thoughts about organ donation in the comment section. You have 6 minutes to do so. Okay, some of your answers seems very interesting and thank you for responding. So most of the answers that I see here is more to saving lives. And someone wrote that they are scared actually, but now no. And someone else wrote that they thought that you have to lose your life so that you can organ donate. Well, Yeah, each and everyone have your own unique and interesting answers. It's an honor to save life. Very noble of you. All right, without further ado, now let's begin our talk with our guest speaker, Dr. Melvin Edward Anak Laki Anthony Das. Before we start, I would like to thank Dr. Melvin on behalf of AMSA UPM for accepting our invitation to become the guest speaker of the day. Thank you, Doctor, for being able to allocate your time to share with us this organ donation and transplantation talk session. For your information, Dr. Melvin is the Head of Department for National Transplant Resource Centre (NTRC) at Ministry of Health Malaysia (KKM), Senior Principal Assistant Director for Unit Perkhidmatan Transplant, Bahagian Perkembangan Perubatan. He's also a medical doctor graduated from Moscow, certified health manager, and has his Masters of Health Management from College of Health Service Manager Australia. And in total, Dr. Melvin is a doctor with medical background and particular interest in healthcare culture, resource prioritization, and also evidence-based decision making, and has been very passionate in healthcare administration for over 12 years of experience, both in clinical and administrative sector. So, without further ado, I would like to invite Dr. Melvin Edward for his talk. Meanwhile, if you have any questions popping up during the session, don't hesitate to type it down in the comment section as our speaker will come back to your questions during the Q&A session. The stage is yours, Doctor.
Thanks, Arvin, for that introduction. A very warm welcome to all of you. I'm so glad we are able to come together today to learn more about organ donation. I found that your short questions, the series that you just did, was very interesting in understanding the crowd's perception towards organ donation is very important, and that's what we do at the National Transplant Resource Centre. So besides coordinating transplant services within Malaysia, one core component of our function is addressing the awareness amongst Malaysian on organ donation. So the whole idea of scared, being terrified at the beginning, and slowly understanding, that's something assuring and giving us an understanding that we are providing that information for you, for all of you out there. So as I unpack some information today on organ donation, I'd like to hopefully by the end of this session address three objectives. And number one is, of course, understanding on organ donation and how organ donation helps. And to do that, I've prepared today's slides on a frequently asked question basis. So you'd see some questions and then I'll unpack those answers for you. Second of all is hopefully to stir that appetite within you to know more and to seek more clarity on organ donation. And as you do that, you communicate this with your family and friends. And of course, third is it would be great honor to welcome you on board with the many other Malaysians who have pledged to be an organ donor or tissue donor. So before I go further, I'd like to congratulate AMSA UPM for the initiative in organizing such an timely and interesting platform for us to come together to learn and share more about organ donation. So if I could go to the next slide, please. So I thought perhaps to start off this whole discussion is to give you a brief run through of some of the history of transplantation. Now, of course, if I were to go through each and every organ or tissue, that would convert this whole sharing session into a history class, which is definitely not today's objective. So I thought I'd coincide this with the first transplant here in Malaysia. So the first transplant successfully performed in Malaysia was a kidney transplant back in 1975, right? So coincide that history with that. So we go back a bit and we understand how did this whole kidney transplant took place. So the first successful transplant was performed on the 23rd of December 1954, and this was on a pair of identical twins performed by Joseph Murray and his team. Now, prior to this date, of course, there was or has been a series of attempts on organ donation, organ transplantation, particularly kidney, but that didn't result in a desirable outcome. So, you know, we understood that when we talk about transplantation, there is that anatomy component, which is the surgical, the physiology is how it functions, and then thirdly is that immunology. So what this particular transplant did on a set of identical twin was the understanding surrounding immunology component, and with that it had placed the transplant service on a trajectory, a win trajectory. And so today, after more than 67 years of development and research and understanding, transplant has evolved to be a safe surgery that is performed in almost every part of the world. All right, and more importantly is how this transplantation allows that second chance of life, giving recipients hope and some sort of some semblance of normalcy. Next slide, please. So we go back to understanding basics here and what is organ donation and transplantation. Now, organ donation and transplantation are two separate components that exist within the transplantation activity. And so if we understand donation and transplantation, both of it needs to occur for the program to take place. So you can't have organ donation without transplantation and vice versa. So organ donation is the process of surgically removing an organ from a person, and this is organ or tissue from a person, and so this individual is known as the donor, and then placing that into another person, and that is a recipient. So the surgical process of implanting the organ or tissue into the recipient is called transplantation surgery. And why is this needed? So there are many reasons for it to happen, but generally from diseases or injury, the organ or tissue sustains some damage, and of course then fails to function in accordance to the normal function, and that is why organ transplantation becomes a necessary modality for this individual. Thank you. Next slide, please. So as I've mentioned, we started our service back in 1975, so 21 years after the first successful kidney transplant in the world. We performed our first kidney transplant in Malaysia. So it was in 1975, and now we are in service for the last 46 years. So what has transpired over the last 46 years? We are grateful for the 493,481 Malaysians who have stepped up and stepped out to be a pledge to be an organ or tissue donor. So if you're here joining us today morning, the National Transplant Resource Centre, on behalf of the Ministry of Health and the many Malaysians, would like to thank you for that decision in pledging to be an organ or tissue donor. So that has resulted in, of course, about more than 3,500 referrals to the National Transplant Resource Centre for potential donation. And from that number, we have received we have conducted about 2,500 transplant surgeries. So these are 2,520 lives changed in Malaysia, and now they are able to, of course, get a second chance of life. So that is, in a nutshell, the 46 years of transplantation service here in Malaysia. Next slide. So if we look here, it's really understanding, did we do enough? Is this enough? Are we really standing in the eyes of the world? So Malaysia's total transplant rate stands at 5.65 per million population. And so this data was obtained from the Global Observatory Organ Donation and Transplantation, GODT 2020, where, as I've mentioned, we are only at 5.65 total transplant rates per million population. And this number is low given that, next slide, if we look at what are we dealing with. So the latest morbidity study by the Ministry of Health identifies that there is an increasing high burden of NCDs, non-communicable disease risk factors, which is hypertension, high cholesterol, and high sugar in the blood. And so these are all some of the contributing factors towards developing organ failures. And if you look at the graph on your left, we've noticed that we have about 44,000 Malaysians receiving either hemodialysis or peritoneal dialysis. So this is a clear indicator that the volume of patients requiring some form of assistance for their organ failure, and then of potentially requiring transplant, is increasing by the year. And in one study I'd like to highlight here is the potential incidence cases that we're looking at, somewhere around the 19,000 by 2040. And so that tells us a huge volume of Malaysians potentially requiring organ transplant. So, and then we look at the other spectrum, is the amount of organ supply. Now, of course, we would never be able to match it one-to-one, all right? But if we look at the amount of organ supply and get a rough understanding, sort of an eyeball of what could potentially happen, there were only 746 donors so far, and of course, 493,000 Malaysians who have pledged to be an organ or tissue donor. And if we look at our population, we're at 32.5 million. So that's a rather low amount of Malaysians pledging to be an organ donor. So this is where platforms such as this helps us create awareness, increasing awareness amongst Malaysians, with the hope of increasing that organ tissue pledger, and when the time comes, converting that pledges into actual donation process. Next slide. So why is organ donation important? So this is a very important question. So as we unpack some details here, we understand why is it important. And I'd like to share some success stories. So AMSA UPM gave some very interesting video show on the success rates of organ transplants around the world. So I'd like to focus a bit about the transplant success here in Malaysia. Next slide. So we all know there are more than 5,000 Malaysians that are currently on our wait list. And so these are various individuals with problems, either requiring heart transplant, or liver transplant, or lung transplant, or kidney transplant. There are more than 5,000 of them. And what this means is, in terms of hospital stays for these individuals, all right, these are longer stays for them. So, if someone has an organ failure requiring transplant, these are individuals at risk of developing complications within hospital stays. So they may require longer hospital stays. Of course, with that comes increased expenditure to and fro hospital. It limits their daily activities. So, while for many of us, getting up and going to the shop or walking around the block in your housing area would be a normal activity, this could be something very difficult for those individuals, right? The other aspect of it is looking at how you are now hooked up. The individuals are hooked up to a machine requiring, for example, hemodialysis or peritoneal dialysis. Depending on what modality it is, you are required to be at a particular place for long duration of time, and this all limits social interaction. This all limits quality time spent with family, ultimately affecting quality of life. And for some individuals, you are pretty much they are pretty much bedbound, all right, or housebound. So there's a lot of limitations around what they can do, and this definitely reduces the quality of life. So we all understand that transplantation, from the video that we saw earlier, changes this. And you see how that lady was able to come and meet the family member, looking fine, going back to work. So we all understand that with transplantation, that second chance of life allows patients, recipients, to get back into normal routine life. All right, next slide, please. So when we look at all of this, we need to understand what is the evidence behind it. What does the data tell us on organ transplantation? And so this is the Malaysian graft survival rate obtained from the National Transplant Service report. I'd like to draw your attention on two columns, which is the first year post-transplant and the return to work column at the far right. So we understand that a heart transplant, liver and kidney transplant has a 1 year post-transplant rate of more than 80%. So this is 80% survival rate, meaning that the success is rather high and is of international standards. More importantly is the far right column, and how it tells us that these individuals are now back into the society leading normal lives. For example, a kidney transplant patient is able to go on with life without requiring hemodialysis. So these are all good indicators of how transplant helps improve lives. So in the next two slides, if you could help me move the slides, I'd share with you on the two success stories within Malaysia. And so this is a story on Mr. Martin. Mr. Martin was our first transplant a transplant case, back in 1975. So Mr. Martin was our living related renal transplant, and he received his kidney from his brother. All right, surgery was performed in HKL, where HKL today, along with Hospital Selayang, remains as our National Kidney Transplant Center. So Mr. Martin continued to live a normal life without requiring dialysis for 29 years. So that's 29 years of life with his family, not being hooked up to any machine, the freedom to walk about. That's what Mr. Martin enjoyed for 29 years. In the next slide, you'd see Mr. Albert Gunaratnam. Mr. Albert Gunaratnam is Malaysia's second heart transplant. So he received his heart transplant back in 1998. And today, Mr. Albert is one of the longest surviving heart transplant patients here in Malaysia. He still attends his follow-up with IGN. So the snapshot you see here is actually an interview Mr. Albert did with IGN. So it is evident that, surgery improves lives, gives the recipient a second chance at life, and of course, more importantly, that quality of life that improves with it. Next slide. So then comes the question, what organs and tissues can be donated? Now, in the next slide, you'd see the ones in blue and the ones in green. The ones in blue are actually organs that can be donated, and the ones in greens are tissue, that can be donated. Now, in Malaysia, at the moment, we do have cornea transplants. We do heart valves transplants, lung, liver, kidneys, bones, and skin. So these are the transplant surgeries that are offered in Malaysia. You probably ask, why aren't the rest offered? So as we expand, this would become available in Malaysia, but at the moment, these are the transplants that we do here in Malaysia. Right. Next slide, please. So the come question, who can donate? All right. So I think this is where everyone has that burning question. Am I really a candidate for, someone that can pledge to be an organ or tissue donor, whether I qualify or not? Let that question be answered by the medical personnel who attends to you if you have any question. So in the next slide, you'll understand that there are very few medical conditions that would impact the possibility of any one of us becoming a donor. So the key message here is, do not self-evaluate. Let that be something that is done by a medical personnel, and we would be able to address your concerns. So for example, if you're having hypertension, that does not disqualify you entirely, or if you're having diabetes, let us walk with you and answer those questions. Just do not disqualify yourself at the very beginning. So anyone can be an organ donor regardless of the age. And if you remember in the story early on, we had one baby who was donating, who saved 3 lives. So the youngest in Malaysia is an individual aged 25 days of life. So that's 25 days after being born, being the youngest donor in Malaysia. And now the oldest so far is one that is 82 years old. So really, there's never an age too old or too young for anyone to be a donor. All you got to do is have that clear conscience and understanding, and more importantly is communicate that intention of yours with family members or your loved ones, right? So in the next question that I have addressed here is the types of organ donations that we have in Malaysia. So it get a bit lengthy here, but we want to understand what types of organ donation we have in Malaysia. So in the next slide, you'll understand that there are deceased donation and living donation. So I attack the living donation first before we talk about deceased donation. So living donation is where an individual who is still alive will be able to donate, may be able to donate part of his or her liver and one of his or her kidney. So this is a very targeted approach in organ donation, and it requires a living donor who has an altruistic intention, and of course, more importantly, one that is consented. It's an elective procedure, and it's done in certain centers in Malaysia, and the recipient can be anyone. So, for example, you are looking at family members, so father, mother, brother, sister, grandmother, grandfather. So these are individuals that can choose to donate part of a liver or one kidney. That's living donation. The deceased donation is one that, of course, requires a donor who is deceased. The individual may or may not be a pledger, but most importantly is family consent. So the family has consented for organ donation, and it is a condition where an individual is able to save up to 8 lives. So we're talking about organs or tissues that can be donated. A deceased donor may be able to donate his or her heart, the kidney, lungs, liver, corneas, skin, bones. So these are organs and tissues that can be donated from a deceased donor. And so, who are the recipients of our deceased donor? These are recipients from our national wait list. So, we do have a national wait list that has, for example, heart patient, lung patient, liver patient, kidney patient requiring transplants. And so, when there's a deceased donor, we would go through the list to obtain to get the right recipient for the donation process. And of course, we are unable to time any of this, so it falls under the category of an emergency procedure. So it is something that is done out. It may be done outside the normal working hours. So the National Transplant Resource Center works 24 hours with all of our transplant surgeons around the country. So if there is a potential donor, we would be able to address that appropriately, right? So we jump on next to the next slide where we talk about deceased donation, right? So I think we all read this now, that there's that girl who was diagnosed with brain death. The brain swelled up and was not functioning. So that's considered brain death, and brain death is it's a legally accepted form of death. And in Malaysia, it has been exempted by Majlis Fatwa as an accepted form of death, right? And so this is the only form of death that is used in Malaysia for organ donation. All right, and what happens in this is when a person presents to the hospital, and when series of tests has been has been done, and the person has been diagnosed with brain death, or rather suspected as brain death, we conduct tests on this patient, and this test is called is known as the brain death test. So brain death test is a series of tests that are performed by trained physicians who's able to understand the normal function of the brain, and to conclude that this individual has suffered brain death. So, um, you know, it's important to understand that the team involved in the care of the patient we are never part of the team, meaning the National Transplant Resource Center or the transplant team is never part of that treating team. So that is done independently, and only when the person has been certified brain death, do we get notified on the potential donor? So of course during this time the attending physician may present or mother may talk with the family or have that conversation with the family on organ donation, give them that opportunity to think about it regardless of the outcome. And then when the family comes to a decision, and if it turns out to be one that is yes for organ donation, then only the NTRC or the donor coordinator comes in to assist the family. So our aim here is always to ensure that it is an efficient process, one that is done with full of respect for the donor and the family. So that's brain death. And we have circulatory death. So circulatory death is when the heart stops pumping. And so sudden cardiac death is an example of a circulatory death. And in Malaysia, we are only able to obtain or rather retrieve tissues at the moment for this form of death. So we need organs that are continuously perfused and optimized, so that when we retrieve those organs, we are able to ensure that it's in an optimum condition when we transplant them. So organs have shorter lifespan outside of the body as opposed to the tissue. So we do not practice circulatory death at the moment for organ donation. So those are the two types of disease donation that we have: brain death and circulatory death. If we move on to the next slide, our question here is then, where are our transplant centers? So, a lot of times we've heard about transplant, we've heard about organ donation. So where exactly do we do this? So in the next slide, you'd know that we have a few transplant centers, right? Hospital Kuala Lumpur, Hospital Selayang, Hospital Sungai Buloh, Institute Jantung Negara, IJN, and Hospital Tunku Azizah are the national transplant centers. So they perform varying types of surgery. So for example, in HKL, we do kidney and cornea. In Selayang, we do kidney and liver. In Hospital Sungai Buloh, it's known as our cornea center, and it's also the tissue bank, national tissue bank for corneas. IGN conducts both heart and lung surgery, whereas Hospital Tunku Azizah performs the pediatric liver services. We do have support from our university counterparts, which is UMMC, that conducts liver, kidney, and cornea transplant, as well as some private institutes, centers, for example, Prince Scott, Sunway, and Mahkota. So these are centers that perform living-related renal transplants only. So this is where all of our transplant takes place. If it's a disease program, a disease donation, so it goes to HKL, Selayang, Sungai Buloh, IJN. So this is a snapshot of where the transplant centers are. Can I have the next slide, please? All right. So I thought as we come closer to the end of today's session is to give you an overview of the donation process. And so by understanding what we do back end, perhaps you'd get a clearer picture on how the organ donation takes place. Can I proceed? So again, this is something that you'd see very linear, very clean, right? So don't be fooled. It's a very complex procedure back end. It's always, to ensure that the patient, the donor, the recipient, the families are all cared for throughout this entire time. And it is our goal to ensure that this process is done in the most efficient manner. So when there's a potential donor, that is referred to the Transplant Resource Center. So the National Transplant Resource Center is where all disease donation coordinations occur. So we are responsible for disease donation throughout the country. So our primary aim here is to, of course, efficient manner of the entire process. But before we go any further, we always would want to know the brain death certification, if that is done. And if the donor management component, so it's managing that patient, the potential donor throughout this time. So once that is ascertained, then we move on to the next component, which is the consent. So as we all know, consent is the key in our process. So we never progress without consent. So anyone, even if you're a pleasure, it is important that we obtain consent from the family first. So once that is done, then only we continue with a few other things back end. So on the recipient evaluation, so this is where our transplant physician comes in, and they conduct recipient evaluation. So the recipient evaluation is a process that is done over time, of course. So when this person, individual presents with organ failure requiring transplant, so we do evaluation on them, and so we put them on the national wait list. And so when they are on the wait list and there's a potential donor, our transplant physician, so if it's a kidney, then it's our nephrologist. If it's liver, it's the hepatologist that evaluates. If it's the heart, it's our cardiologist. And if it's the lung, it's our pulmonologist that comes in to evaluate recipients. And so they will help us understand a match between the organ donor and the recipient. So that's the recipient evaluation component. If we look at the part where I've mentioned logistic, workforce, and laboratory arrangements. So this is what the National Transplant Resource Center coordinates. So we look at logistics. So for example, we may have an organ in a potential donor in Malacca, and we have our recipients in Sabah, Sarawak, or even up north in Penang. So it's about getting them to our transplant centers ready for the transplant. It is also working on the logistics of the retrieved organs. So we need to take those organs, procure those organs, and bring them to the transplant center. And doing that, we need to arrange for workforce. So who are this workforce? These are our retrieval surgeons. So organ and tissue retrieval can occur in any hospitals where the donor is. So we do not move the donor, we move the organs and tissue. So we send our retrieval team out to procure these organs and tissue, and then bring them to our transplant center. Of course, the laboratory, as I mentioned, is ensuring that there's a match between the recipient and the donor. So that occurs back end, and once all of this has been addressed, the family is ready, then we move on to the procurement, the retrieval part of the donation process. So this is a process that we do in the operating theater. So we do have questions coming our way asking, how is this done, or where is this done? So in all procurement surgeries are performed in theater where the patient is anesthetized, and we give pain management. So it's not entirely a painful process for the donor. All right, we do take care that a much effort is put into ensuring that the donor and the family is well cared for throughout this entire process. And so once we've retrieved those organs, we then take these organs either via air or land to our transplant centers where transplantation occurs. Now, somewhere between the consent and the retrieval of organs, the team from National Transplant Resource Center would offer the family, if they would like to know about the outcomes of the transplantation. So in Malaysia, we do not connect donors with recipients, the donor family with the recipient, but we do offer that middle ground communication. So if the donor family would like to know the outcome, then the outcome of the surgery would be communicated with our donor family. So sometimes we find this as a good closure for the family, and it's also very interesting to know how the recipients are doing. So that's in a nutshell the entire donation process here in Malaysia. If I could move to the next slide. So I guess I'd come to the most interesting question, which is how can I be an organ donor? It's very simple. So if you are Next slide, please. If you are a Malaysian, you're above the age of 18 and you would like to register as an organ donor, do come on by to the National Transplant Resource Center, or alternatively, you can submit your application via www.dermaorgan.gov.my. So there's a link that says pledge now or saya nak ikrar, or alternatively, you can send that email through to us. I want to pledge or saya nak ikrar to ntrc@moh.gov.my. Now, we do have circumstances where the pledger is someone below the age of 18. If that's you, then you need to walk into our center with your next of kin. So we've got to ensure that both pledger and family understands the concept of organ donation. So all we got to remember is one pledge gives a million hopes, right? Now, if that throughout the your throughout the process, if there is a requirement to update your contact information, or if there's a change of circumstances, do communicate that with us. You'd be able to communicate with us via the email that is shown in this slide. Now, the process does not stop here, because it is important that you communicate your intentions with your family and your loved ones. You got to let them know why and what are your intentions. So if we move on to the next slide, and this is an important question, and we always get this, is must I communicate my intentions to donate with anyone? The short, simple answer to this is yes. Why? So as I unpack this in the next slide, we understand that in Malaysia, it's an opt-in system. So meaning, for you to be an organ donor or tissue donor, you have to state your intentions to come into the system. So you're opting into the system, all right? But we respect the family institutions in Malaysia, and therefore the family consent is always needed. So we never perform organ donation or transplantation without family consent. So what we understand from this is the NTRC data indicates at the moment that there is high family refusal rate. I think this is sometime in 2017, where more than 90% family refused organ donation. Now, of course, this is entirely the family's decision, and we respect this decision. But when we ask why, a lot of them give us this. The family is uncertain about the deceased decision. So nobody knows really your decision. So it's important that we communicate this decision with your family, right? With if you are having trouble communicating this with your family, we'd love to sit with you. So do contact us. You do have our phone number down there, or head on to our email and write us an email. We'd help you with the communication component. So what is it that you need to speak to your family about, and how to start that conversation? Right. And the second part is, as a result of this high family refusal rate, is a lot of them are not wanting the deceased to further suffer. So this further suffer stems from two things. Number one is the pain component, and number two is not looking appropriate, or some form of disfigurement following organ or tissue donation. So I'd like to spend a bit of time to unpack this information for you. As I've indicated earlier, all of our retrieval surgeries are done in an operating theater, where we have a specialist anesthetist in there. We have specialist surgeons around to procure, to retrieve organs and tissues. So it is done in a condition where it's controlled, where we give anesthesia to ensure that the patient is deeply sedated, that there's sedation going on, there is pain management going on. So we do give all of this during the retrieval surgery. So there's the question of pain will not arise here, because we address all of that. In terms of the disfigurement, so as I've mentioned, we have our specialist surgeons on board retrieving organs and tissues. So we take every effort to ensure that the whole process is done with respect and dignity. And so when we return the remains to family, this is always done in a respectful manner. and more importantly is one that does not demonstrate any form of deformity. So there's a lot of advancement in the way we do retrieval surgeries, and so these are all practiced here in Malaysia. And so when we return the remains, it's always without disfigurement. So these are the two things that we need to understand on organ donation. So if you have that intention to pledge to be an organ donor tissue, have that communication with your family, and so speak with them and address those concerns. And if you require further assistance in understanding more about the retrieval surgery or the process, the duration, do communicate that with us. We'll be able to assist you throughout this journey. All right. Next slide, please. So I thought before I end, I'd give you what we call a vital cycle in organ donation. And this is basically to tell us on the various components of various parts, various roles everyone play within the organ donation and transplantation service. Now, this was something that was created by Dr. Martin Manialich back in 1999, titled The Vital Cycle. So the vital cycle has four components. So you have the society part, donation, procurement, and transplant. Society is you and me. So we play an important role in all of this. So without understanding, without clarity on organ donation, the whole process would not start. So it starts from us, from you and me. So if we understand and we pledge to be an organ or tissue donor, then we get the whole process rolling. So the whole process will not start unless we have that conversion from a pledger to an actual donor when the time arrives. So when the time arrives, that intention is converted into an action, and so that's where organ donation takes place. And so this role is played by the National Transplant Resource Center, where our coordinators, who are trained doctors and paramedics, assist in the donation process to facilitate the process, ensuring that it's done in the most efficient, respectful, transparent, and full of respect for the donor and the family. All right. So once family has consented and we are able to get those organs, then it enters the next phase, which is called the procurement. So this is where we send out our retrieval surgeons to go and retrieve organs and tissues for donation. So these are done by a team of surgeons, and of course with our physician support, our laboratory pathologist support. This process is that's their responsibility. And so when that occurs, then only can we have the transplantation program running. And so this transplantation is done by our surgeons who are transplant surgeons. And once this is completed, the patient then goes back into the society, like the one we saw in the video, or Mr. Albert Gunaratnam, where they communicate what has happened to them, share their experience, and this then generates that whole desire and keeps this in a vicious cycle. It continues. So every one of us plays an important role in organ donation. Organ donation not only saves lives, it improves quality of life, and it is up to you and me. So with that, I'd like to end my sharing session with you on a quote by Albert Einstein, where only a life lived for others is a life worthwhile. So with that, I'd like to thank you all for joining us. And I guess we'll open this time for some short question and answer. I may not necessarily be able to answer all of your questions, but if it is required, then I'll probably get your email address and I'll get one of my team members to communicate with you and to answer those questions specifically. So thank you, Amza. Arvin, back to you.
Thank you so much, Dr. Melin, for the informative session just now. I guess we have a few questions from the comment section in YouTube Live. We will go for each question one by one. Meanwhile, participants are strongly encouraged to ask questions regarding our sharing session just now. So for the first question from Florence. If I donate my organ, will I have health problems in the future?
Right. So I think, Florence, you're referring to a living donation. I hope that's right. Uh, so if it's a living donation, it's a process that requires both recipient and donor to go through vigorous testing. So we look at every component within you. The physician is there to assess you. And so once we have established that you do not have any medical conditions and you are a fit donor, would that process only take place? If we do find some discrepancies or something to be concerned of course, the process does not take place. So I may not necessarily be able to answer future, but we do ensure that we take into consideration life as a whole before we allow living donation to take place. Thank you, Florence. A very interesting question.
All right. So for the second question will be from Tat Kwan. Doctor, can you explain more on the circulatory death?
All right. All right. So circulatory death, as I've mentioned, is when the heart ceases to function. All right. So there is no more pump that circulates blood around the throughout the body. And so when that happens, and so maybe not when that happens. So what type of disease can contribute to a circulatory death? So you're looking at, as I mentioned, is now sudden cardiac death. So sudden cardiac death is one of the major contribution towards circulatory death in Malaysia. So it's a sudden stop of circulation within the body. So when that occurs, there's no perfusion, so organ starts to fail. So it starts with your brain. So after 3 minutes or 4 minutes without circulation, your brain starts to degenerate, starts to fail. So that occurs, and then so forth, so on, so forth. It goes on with your organs. So tissues then tend to have longer duration. So that's when we use tissues for donation in circulatory death components. We do not use organs for circulatory death. So that is in general what a circulatory death means. So I hope I've answered your question, Tat Kwan.
All right. For the next question from Alicia, can people who recovered from COVID-19 donate their lungs?
Oh, this is a very interesting question, Alicia. Thank you. Of course, evaluation needs to take place. Uh, it depends actually on the severity of the infection and how that has impacted the lungs. Of course, as I've mentioned, when the time arrives, evaluation takes place. Past diseases play an important role, of course. So if there are some end organ damage, or if COVID-19 had affected the lung badly, then this may not take place. But we do know that there are places around the world where COVID-19 patient requiring lung transplant has taken place. So to answer your question, it all depends on the evaluation and the extent of the disease.
Thank you, Doctor, for that. And the next question will be from Shagan. Hello, Doctor. May I know why is the survival rate for 10-year post-transplant is missing? Is it because the prognosis is very low?
No, well, again, our datas are updated from time to time. So this is where, we are in the midst of updating our data. So it's my mistake for not putting it there. It does not really mean, but of course, as time progresses, survival rate may come down as well. So not necessarily that, the prognosis is very low. But ultimately, we got to look at what we have at hand, and we look at the 1 year and 5 year, and these are very, very promising numbers surviving. So for a transplant, for a patient with organ failure requiring transplant, any duration extended to what he or she has is something that is very important. So, for example, if we look at Mr. Albert Gunaratnam from 1998 until now. So that's more than 10 years already, and he's still surviving. So that's a good indicator that, we do have good stories out there.
All right. So for the next question will be 25 days infant cannot give consent for organ donation. Is donating his organ violating the medical ethics?
No, we do have family consent. So at 25 days of life, parents are responsible for the decision. So we do have, as I mentioned, all donation process requires family consent. So we do the process in sorry. The donation in this case occurred following family's consent, so it does not violate any ethics.
All right, thank you for the clarification, doctor. I hope she understands. And next will be from Ivy. Can organs be donated twice?
Interesting question, Ivy. So I'm assuming that if you, sorry, not you, if one person has received, for example, kidney as a recipient, and then when the time arrived, that person then donates that kidney back to another person. So I'm assuming that's your question. If that is your question, then the answer is generally no. Why? Because when we perform transplant, in the very first line, if you remember, I talked about the components of transplant. So you have the anatomy, the physiology, and the immunology components. So all transplant patient receives immunosuppressive drugs. And so these lifelong drugs do alter some form of physiology. It impacts the organ, and therefore disqualifies it from being donated again. However, if the person has received kidney but still is a normal functioning liver, cornea, heart, or lung, then that person may donate those organs.
All right, doctor. For next will be from Florence again, who is not considered for the organ transplant list because I heard that she's no pediatric patient is not considered as a good candidate for organ transplant.
Okay, so Florence, interesting question. Perhaps I guess I'll answer in general. All right. Uh, So I answer in general. We do not disqualify a person just because of certain conditions. But of course, there are requirements that needs to be addressed. And why do we have these requirements? Because if we look at our supply chain, the amount of organs available versus the amount of people on the list, we've got to look at the best utility concept. So of course, when it comes to such a complex decision, we've got to ensure that we take into consideration every part and every component. So there are of course specific lists, but I would not disqualify schizophrenic, and I may not be an expert to answer this question in detail. All right. If you'd like to know more, do send us an email. We would be able to communicate with you on the specifics of it. But in general, we do have a set list of requirements needed for a person to receive an organ or tissue transplant.
For the next question from Anas, is there any side effect on receivers' health who receive donor organ in future? Do their lives live totally normal with a donated organ?
I think that's a different question than what I'm reading here. So I'm reading
Oh yeah.
here on the main reason that causes low rate of transplant in Malaysia, right?
Sorry,
So
doctor.
thanks. No, that's all right. Thanks, Hazel. Interesting question. It is multifactorial, definitely. As I've mentioned in my last few slides, we do have high refusal rate, and so that stems from awareness and understanding. Of course, religious beliefs do play a part as well, but we are seeing that trend slowly changing. So over the last 46 years, we've seen increasing increasing pledges from various religions, and that tells us that the understanding is slowly building up. In terms of insufficient medical team, we are able to cope with that, but of course, with as the numbers pick up, we do need to have more and more medical team. The workforce needs to grow with it as well. So we are at it is something that is of course part of the Ministry of Health to look at workforce development, and we are addressing that concern as it goes. So it's definitely a multifactorial condition resulting in low transplantation, but it always it's a team thing lah. So everyone needs to play their part in getting the whole program running. Next
Alright,
question.
so well, the next question is from Anas. Is there any side effect on receivers' health who receive donated organ in the future? Do their lives live total normally with the donated organ?
So thanks, Anas, for that. And so if you remember, I shared a story with you on Mr. Martin. Mr. Martin went on living his life for 29 years. Now, no one will be able to guarantee that, if every person that comes out from a transplant has we can guarantee X amount of years. We don't do that, but we do know it improves quality of life. So in Mr. Martin's case, he's there he lived for 29 years without requiring dialysis at all. We do have patients who have similar outcomes. Of course, there are conditions where unfortunately graft does not happen, the graft is rejected. So of course there's that component to it. So yeah, it all depends on the surgery. It all depends on the patient. It all depends pretty much on what we have, and so we would go as it is. But data indicates so far that some do have a longer life without requiring dialysis.
All right, for the next question from Hannah. Good morning, doctor. Why can't some organs be donated?
I'm not so sure if you're referring to the comparison to what is offered elsewhere as opposed to Malaysia. So I assume that's your question here. These, of course, requires development and training within that. For example, pancreas or small bowel. So these are all fields that are growing, and we are still a growing field in Malaysia. And rather more than in addition, if we look at the disease burden in Malaysia, kidney, heart and lung, liver, these are the ones that are predominant in Malaysia, and so that's why we have those services up and running. But in the future, would we have those services? Yes, the answer is yes. It just takes time to develop that as well.
All right, the next question from Hannah again. Good morning, doctor. Can patients that undergo euthanasia donate their organs to prevent wastage?
I think there's two components to this question, which is euthanasia and organ donation. So euthanasia is not something that is permitted in Malaysia. We do not practice this. So that then disqualifies this whole this idea of euthanasia to promote organ, or rather to prevent wastage of organs. So we don't do euthanasia here in Malaysia.
Hope it explains. Next will be from Saranya. I'm just curious, doctor, on average, how long a person in Malaysia needs to stay in the wait list to receive an organ transplantation?
Thanks, Saranya, for that question. It depends really on what organs are we looking at. And if you remember the supply and the disease burden at the moment, we have a huge volume of Malaysians requiring transplant, but our donation rate, transplant rate is rather low at the moment. And so with that, one can already understand that there's an extended duration for waitlist. We do have patients that are sometimes waiting up to 10 years, 12 years for a kidney in Malaysia. And that is the problem why we are having today, and that is the reason why we're having today's discussion, to increase awareness, to get more people to at the right time convert that pledge into actual donation. Whether we do have patients on the wait list passing away or no, because of a long duration, that definitely occurs. But uh, so yeah, that is where it is at the moment. For heart and lung and liver, these are emergency surgeries. These are considered emergency transplants. So of course, the wait time should be shorter, and I would not be able to pluck out an exact number for each of these organs. But what I do know for certain is transplant rate for kidneys are actually within that 10 to 12 years at the moment.
So the next question will be from Saranya again. And what will be the common criteria to prioritize organ recipient from the wait list?
All right. So again, this is a very broad question. It depends on what particular organ or you're referring to. Um, the common criteria, of course, would be if the age factor. So the older the person is, could be more difficult to recover from the surgery. The surgical process is definitely a stressful process. Then you do have the other components, the other comorbidities that come along with it. We look at immunology component as well. So there are multiple various criteria that we look to in prioritizing organ at the moment. Of course, our aim is, whenever we have someone on the list, that person is then immediately able to almost immediately receive an organ, and that's something that we will work towards.
All right, doctor. So from next question will be from Ivy. Hi, doctor. Can I donate my corneas when I'm alive?
Thanks, Ivy. Unfortunately, if we remove the eyes from someone who is alive, that person will not be able to see. So at the moment, not at the moment, corneas can only be donated following death. Yeah.
For the next question from Go Junhui. Hi, doctor. Can I be an organ donor if I die outside the hospital?
Organ donor, no. Tissue donation, yes. So we do have instances in Malaysia where the donor passes away at home, and the National Transplant Resource Center is notified on a request for donation. So we do have tissue donations if the person dies outside of hospital. Organ donation, as I've mentioned, we need to optimize organs, and so if there is a circulatory compromise that affects the outcome of the organs and therefore disqualifies organ donation in these instances.
The next question will be from Tan. Did doctor witness any patient that wait at the waiting list too long until they died? Can doctor share some of most incident that touched doctor the most?
Now, I have to be very truthful here. I have not encountered. I do believe my colleagues have encountered this, but I can definitely share an incident, not incident lah, an outcome of a patient who received uh, a kidney. So this is a person who waited for the longest time for her kidney, almost 12 years, and it was during my call that I was part of the transplant team, and I was able to see this individual go in without a functioning kidney and then come out with a functioning kidney, and how that really changed her life. And things that we take for granted, for example, urine, having to go to the toilet to urinate, for us we take that as a normal thing and we take that for granted. But for this individual, it was uh, an an exciting moment for her that she was able to now produce her own urine. So It's definitely heartwarming, and I think the videos that you shared earlier, Arvin, all right, when we start before we started, I think those are things that we definitely see in the hospital. Teary moment. It did bring tears to my eyes just now, because as we watched that, I of course then remember my experience. And as I remember my experience in the hospital, I always think about the outcome this does for those patients and how it changes their life. So it's definitely something that all of us should think about when it comes to organ donation. I myself have pledged to be an organ and tissue donor when I die, and this is something that I've communicated with my family. So yeah, that's what I like to share.
All right, for the next question. Hi, doctor. I've registered myself for organ donation in 2018. Do I have to renew my registration?
No, Atira, you don't have. Once you have a pledge, you've received your card, you would be on the list unless there is a change of circumstances, or if in 2018 to 2021 you have changed address or email, do contact us. This would help us communicate with you in the future. Now, we are going through some transition at the National Transplant Resource Center, and one of our aim is to produce a newsletter for our pledges. And so this is basically to let pledges know about the current scenario in Malaysia, and when and if it permits, we would like to share some stories of organ donors, family donors stories, as well as the recipient stories, to help all of us understand better this whole process. So in short, Atira, the answer is no, you don't have to renew your registration.
All right. So next will be from Muhammad Imran. Doctor, would you rather donate your body to science or donate organs to others?
I think that's a very personal question that we need to ask ourselves. If you are, of course, the answer is what, regardless of the option, this is something you choose for the betterment of our society. If you ask me personally, and if this is a personal question, then my answer would be donating organs and tissues, because this changes life almost immediately. And I'm a person who likes to see, who desires outcome immediately, and I would definitely then choose to donate organs and tissues. So thank you, Imran, for that question.
Okay, for next question from Hannah again. Um, Good afternoon, doctor. If somebody commits suicide but had previously signed up for organ donation, can their organs still be donated if they're still functional?
So when we have conditions like this, it's of course requires legal process to commence, and most of the time, as I've mentioned, if it's death occurring outside hospital, organs will not be able to be, we are not able to retrieve any organs. Tissues, there are still possibility, but it all depends on the legal process. And so that requires us to get a lot of inputs from the police, the magistrate. So there are a lot of components that happen back end before we decide whether this would be something that is something that is feasible. You're welcome, Imran.
All right. Next will be my own question, doctor. Let's say if the waiting list is quite long and the transplant surgery is not available in Malaysia, um, would the hospital or NTRC recommend for overseas surgery, or would they advise in something else?
I think this is a very sensitive topic at the moment. We all do understand that the supply for organs is rather low in any country, and this is a challenge, not only something we see in Malaysia but many countries out there. So when we have that question, the next thing that the questions that it begs is uh, whether it is an ethical donation transplantation process. And so that is something that we are concerned about. And so if we have people going overseas, the first question that we'd always ask is, where did the organs come from? So we always will try to negate away from this concept of going overseas for transplant. We have in the past, of course, in instances where we do not have the means and the necessity to conduct surgery, to conduct transplants, and so we send transplant patients together with the donor. This is living, of course, external to Malaysia for surgery, but that is not something that we widely practice on the reasons that I've mentioned earlier.
Understood, Doctor. Thank you very
Thanks.
much.
Thank
So I
you.
think that will be the end of the Q&A section. So for whoever wants to, whoever has any other question, you can email to ntrc@moh.government.my.
Thank you.
All right. So proceeding to our next agenda. On behalf of AMSA UPM, I'd like to present to Dr. Melvin Edward, Head of Department of NTRC, the e-certificate of appreciation for your contribution and willingness to be our guest speaker today. It was really an interesting and enlightening sharing session just now. Thank you, Doctor, for being able to be with us today to share in today's Organs for Health Awareness campaign. I'm sure the public and students who listened to our session just now would have a better understanding about this issue after the talk. Thank you, Doctor.
Thank you, Arvin, for this opportunity.
All right, well, you're welcome, Doctor. Sorry. Well, the event will be imperfect if there's no photos taken as our memories together with our speaker and for future reference. So we shall now proceed to our photography session. Dr. Melvin and AJKs are strongly encouraged to open your camera and show your bright smile while our technical team takes the photo. I shall now pass the session to our technical members.
All right, Alicia, may you please open your camera? Right. Everyone's ready? 3, 2, 1, smile. Right, the photo has been taken. Thank you.
Thank you.
All right, thank you everyone, and thank you, Dr. Melvin, once again. We shall see you again in future for more upcoming events and wish you a Merry Christmas.
Thank you, Arvin. Thank you, everybody. Have a good day.
Thank you, Doctor.
All right.
Okay, now comes the high time for students of Faculty of Medicine and Health Sciences UPM as we will proceed to our e-merit session. Attention to all students, please listen attentively to the following instructions. First, QR code and Google Form link will be shown and pasted in the YouTube comments section. Please fill in within 3 minutes to record your attendance. Thank you everyone for attending this session. Do like and share our recorded video with your friends and family members who might have missed this session so that they can gain benefits from this session too. And guys, please do not forget to attend our next event. Let's hear her story, which will start around 2 p.m. We have come to an end for our session, so thank you everyone. My name is Arvin, signing out as the moderator for Organ Donation and Transplantation Talk Session, AMSA UPM Organs for Health Awareness Campaign 2021. Thank you and wish for those who are celebrating Merry Christmas, enjoy your holidays, and have a nice day ahead. Goodbye.